currently in phase 1A of reopening the city of Norman. Many social distancing and safety guidelines are still in place, especially when it comes to healthcare. Elective surgeries are back underway, but that doesn't mean everything is back to normal. Here to explain is Dr. Tom Connally, a board-certified general surgeon for Norman Regional who specializes in endocrine surgery. Thank you for taking the time to speak with us today, Dr. Connally.
Thanks for having me.
So things are very different and people are still getting used to it. I think some people waited weeks or even months for a previously scheduled surgery. Now they can get it, but they're still having to wait a bit. Can you explain why that is?
Absolutely. Thank you for giving me the opportunity to do that, because we're getting a lot of phone calls in our office, and I know there's a lot of people out there wondering about what's going on. So just like we have a phased reopening across the country for businesses, et cetera, we have to do the same thing in healthcare. We know there are people that need their surgeries. We've only been doing urgent and emergent surgeries up until now because of the COVID risk. Certainly the COVID risk is still out there. So we're trying to bring things on slowly. We do it in a phased approach as well. And so we're starting with the outpatient surgeries, those surgeries that are of lower risk, lower time spent during the surgery, lower health risk for patients. And so we want to make sure that we start slow as we bring people in. This needs to be difficult for us in getting folks on the surgery schedule on purpose so we don't have too many people at once, because we still need to maintain that social distancing. And as we have to do as we're doing surgery, then that means people have to come into our clinics as well. So we have to be very thoughtful in that process.
You kind of touched on why these guidelines and limitations are so important. Is PPE part of that as well?
Absolutely. So, one of the things we have to do as we're doing this, we need to make sure that if there is a second spike on down the road, we hear that in the news, we hear Dr. Fauci talk about that, Dr. Bricks, we want to make sure that we have the appropriate PPE as far as reserve in case we were to have that second spike. And so having that available is important. I think the other piece that's a challenge, not just having the appropriate PPE, is that we need to know that patients, the challenge that we've learned in this COVID event is that there are so many asymptomatic patients who are able to pass the disease without even having symptoms. I mean, up to 80%, right? That's a number that's out there. Up to 80% of patients, before they become symptomatic, are actually shedding the virus. And so that means that number of people that can be infected is so high based on one person. And so to make sure that we're not taking people to surgery while they're shedding virus, we want to make sure that they get a swab, a COVID swab, the PCR swab before surgery. So that's a rate limiting step, because there's two reasons we want to do that. Number one, if you are COVID positive and you undergo an anesthetic, your risk of surgery is much higher, right? Because if you're not only having to deal with the risk of surgery you're doing, but now you're dealing with the risk of COVID on top of that, it's very challenging for you as a patient potentially, and more risky for you to have it. So we want that COVID test. Now, we all know the COVID test, the PCR test is not perfect, but it's the closest thing that we can have once we do a symptomatic screen. If you have a fever, if you have any flu-like illnesses, you're automatically excluded. You don't want your surgery right now. You want to wait if it's elective. If it's emergent, that's a different story. This is not what we're talking about today. We're talking about these elective surgeries. We're still doing emergency surgeries. We're still doing urgent surgeries like we've been doing before. This is the elective operation, right? And so, so we want to be able to get those patients in surgery, but we need to know that they're COVID negative. The other reason it's important for them to be COVID negative is to protect those who are taking care of those patients. So we want to protect our healthcare providers as well, because again, you bring someone in who's COVID positive, now you've broken down those social distancing barriers with someone who is actually spreading the disease or the virus that can infect others. And so we want to be cautious and careful as we onboard surgery.
No, I really appreciate that. All of the hard work of our healthcare providers and healers at Norman Regional. We've talked about the true heroes through this whole epidemic. So thank you all for your work and what you've done to keep us safe. So are the surgeries being rescheduled in the same order that they were canceled, or do you have a formula for prioritizing surgeries?
Very good question. We really right now are starting not based on who got canceled first. Those urgent emergent surgeries again fall out of this whole equation. It's for the elective surgeries, and so we're bringing in the healthy people those lower intensity surgeries. If you have something that's going to require you to be in the hospital for days and days after that surgery, well, you should wait. You don't want to be in the hospital right now. You want to continue to delay that surgery as we make sure that as we open back up, that we don't have an issue with the an increase in patients who are the community pass with the COVID, with that virus spiking again, I guess. And so we want to start slow. So we're starting with outpatient surgeries, those surgeries that maybe have an overnight stay, but not longer than that, at least anticipated. We all know that we can't predict everything in medicine. And so we're trying to be cautious in predicting those patients that come in and go home the same day, or just a one-night stay to start out. And so younger, healthy, and trying to minimize a lot of patients with a lot of medical issues. So multiple medical issues, you don't want to be out having your surgery right now. You still want to be in that second or third phase as we approach and ramp things up.
Well, with our Healthier at Home initiative, we also keep encouraging people that if you are of an older population or have these health issues, you still need to be at home because, we're still trying to get a hold of this virus. So I appreciate you making that clarification about people's own health in deciding whether or not they need to move forward with elective surgeries. But I also agree with what you said earlier about how so many people are asymptomatic and are shedding the virus. It's very, very scary. And so masks, facial coverings, Dr. Razkov, who's been advising myself and the council and our emergency management team, every single chance that he gets to emphasize the importance of masks, he does. And so masks are part of the new guidelines for surgery patients as well. We are strongly encouraging everyone to wear them in public, but I've heard from many people who were out this weekend and they didn't see many masks. So what can we tell people to get them to understand why it's so important to protect yourself and others with facial coverings?
Well, as you can see, I have my mask right here, and I would have had it on if I were not having this conversation because I know it would muffle my voice and be harder to understand. I wear a mask everywhere. I wear something to cover my face everywhere when I'm out, and I do it on purpose. And why is that? I believe I have a civic and a moral obligation to protect my fellow citizens. The science can go both ways. We've seen that the science can tell us that maybe it's not helpful, maybe it is. I think if there's potential that it's going to be helpful, we should take every advantage we can to do that. We know it's not going to protect ourselves when we wear the mask, but it's potentially helping others that are out there. And if I know that I could be shedding that virus asymptomatically and giving it to someone else who could subsequently give it to a bunch of other people, remember, this thing grows exponentially, right? Based on that R naught, that 2.4 or somewhere between 2 and 4, whatever the number is of people that you can infect, and they go and infect others. Again, you're just protecting your fellow citizens. And so while I obviously realize we live in a free society and we have can do what we choose to do, I would request that everyone please wear their mask. I know it's hot in Oklahoma. I know that we have an independent spirit, but remember, we have a frontier spirit here. Think of all the cowboys that wore a mask. Think of the Dust Bowl and people with dust masks on their face. We're doing what our ancestors have done in this state and made it such a proud and successful place. So help others. That's what we're trying to do. This is a call to request. We don't need stuff like what happened in Michigan. It makes me absolutely sick to think that someone died because he was only trying to help people do what should be done, which is to protect others. And he lost his life in Michigan because he asked someone to put a mask on. That's not what this should be about. That just makes me sick at the pit of my stomach to know that could happen. We do not want that happening in our community or in our state or anywhere else. And so I would ask everyone to please wear a mask when you're out. It can be any simple face covering, those like a neck garter. That's what I wear when I went to the grocery store. I have a neck garter. I pull it over my face. When I'm in my car driving, I just drop it down. It's something you can easily put on and take off. When you're out in the parking lot, you're out in the open, you're not around people, take it off. Who cares? But it's something that's right there and easy. In the office, I'm wearing a face mask, though, that I can do the same thing with. So please wear your mask.
No, I'm the same way. My 6-year-old and I, we went out to get some fishing poles this weekend. We've been enjoying the beautiful weather, and he looks like a little bandit. We've got the bandana tied around and he's participating. And I find it amazing that he's observing, hey, that person's not wearing a mask, or mommy, we need to stay 6 feet apart. So I understand he's probably a bit more indoctrinated than the average child. But if a 6-year-old can do it, I'm hoping we all can. But it's that Oklahoma standard, that we hear so much about taking care of each other. And it's such an easy way to, again, help your community. So I second your urge and request, please, everyone, wear the facial coverings. It's very, very important. But to switch directions a little bit, Norman Regional and many other hospitals are not allowing visitors for adult patients. While people understand that decision, it's still tough to be separated from a loved one when they're in the hospital. I've had surgeries where I've woken up from anesthesia and it meant the world to have my husband there, or my mother-in-law even. How are you helping patients stay connected to family and friends throughout their procedures?
Gosh, this is one of the hardest things that I've had to do as a physician, is not be able to engage families in when they're in the room, to make decision making before surgery, to talk to them personally after surgery. I mean, that's what we went into this business for, is to help people. And when you can't have everyone together, it makes it much more of a challenge. So it has been very difficult. I myself, I've taken my own phone and used FaceTime and tried to let patients and families connect. I try to make sure that I'm making those phone calls with the family members present before surgery when I can. Sometimes it's emergencies and we can't make that happen. And right now it's still imperfect. We're still learning how to do some of this stuff. I know Norman Regional, one of the nice things here at Norman Regional, everyone can have access to the Wi-Fi. And so if you have a smartphone, you can do FaceTime. They're working on an initiative to have iPads for those who don't have access to a smartphone, so they can connect to their family members at home. Again, the nurses I know are doing their best to keep families involved and know what's happening. I do a surgery and then the patient the family can't be there. So once they get discharged from the post-surgery unit, the families the patients meet their families downstairs. And so the nurses are still able to go over the important information that family members need to know about what their loved one just had performed. And so again, as a physician, I'm making those phone calls. I'm doing those things to try to help. And then post-surgery, I think we need to talk about this. And I know they're kind of switching gears, but after surgery, I think to try to minimize folks coming back in, continue to use those FaceTime visits or the virtual visits that we can. Remember, that option is still there to continue that social distancing. So once you've had surgery, if you can do a virtual visit, if you can do those things to minimize you getting back out in the community, we need to keep using those things to continue this social distancing until we know it's a safer option for us to be together. So.
Definitely. Now, my oldest son had his tonsils out when he was 6 years old. Children can still have a parent with them, correct?
Yes, ma'am. Absolutely, they can.
Just wanted to clarify that for any parents that are thinking, surgeries like tonsils and whatnot, you will be able to go with your kids. Don't worry about that. But I love your point about continuing to use virtual visits. We've touched on this before in these interviews, where I really hope that a lot of this push to go virtual stays. These are the beauty of technological advancements that we have in today's world, and we've really had to stretch to see how we utilize these tools and even change some of our laws in terms of privacy and whatnot. But I do think there's a lot of good that will come from it.
Well, I totally agree with you. We mentioned at our last visit how happy I was that our government was so quick to open up the use of virtual visits to make sure at least we had some access to care. I will tell you, as a provider, it's hard because I like to see my patients in person, put my hands on them, feel whatever may be a problem to help further my diagnosis. But we have to use the tools we have available. And some people can't, it's expensive to drive to come to the clinic, or from work they can't get off. This may let a lot of people who normally would not come in to see a physician or a primary care provider actually do their visit as a virtual visit to start that process. Let's get that workup going. Let's figure out what it is. Make sure it's not a problem. If you have to come in and have that physical exam before further things can be decided, at least you've met that person up front. You've got a confidence in them. This is still a bit impersonal, I know, but we're with this age of technology. Let's use the things we have to help improve our community's well-being.
No, I completely agree. Access, access, access. Well, thank you so much for joining us today, Dr. Connally. This has been super helpful as always. And thank you all for watching. Please like and share this video to spread the word about how our community is responding to COVID-19. Be safe, everyone.